Well, welcome back, everyone. You know, there's a lot of stigma with mental health and addiction, and there's help out there as well. And Micah Sobota from Coleman Health Services is in to talk about that. Welcome, Michael.
Hey, thank you so much for always having us.
Yeah, definitely. So it is, you know, let's talk about breaking the stigma with mental health.
Oh, well, thank you. That's one of the biggest things that we're here to educate. Mental health is no different than any other disease state. When we're thinking about mental health, and I compare it to a disease state like diabetes. What's wrong with diabetes? There's a chemical imbalance of maybe insulin, sugars. So we got to fix that balance, right? So mental health and addiction is no different. We've got to fix that chemical imbalance. And as a pharmacist, I love medications, but I'm also a realist. Medications aren't the only answer. Just like diabetes, I can't throw just somebody on insulin and think it's going to get better right away. There's going to be improvements, of course. But in mental health and addiction, we got to help with medications, but we also have to have a holistic approach, thinking about talk therapy, change behavior, stress reduction. And that's what we really do here with Coleman Health Services, is get that big picture as a treatment facility.
Right, and it really is kind of like a pathway, right? It's a path. It's kind of almost like taking a class. You know, there's certain steps that you can take, and hopefully things do get better, right?
Oh, without a doubt. Just little pieces, little roadways, additions that add on there. So those little pieces add up to be the big picture. When I start somebody on treatment, whether it be mental health or addiction, I say we're running a marathon, not a sprint. So add these little pieces together. And as medications and pharmacotherapy, that's the start. But we know a lot of times we're not going to see full effects for weeks to months of these medications. So it's a very big education piece that when we start on medications that we have to educate. Don't ask yourself if you're going to be better right away. Ask yourself if you're going to be better maybe week to week, not day to day.
Right, exactly. Now, sometimes there are, cause for crisis situations, but can you explain the We Care Crisis Center?
Yes. The We Care Crisis Center, we are a 15-bed facility for those in crisis. And crisis can mean a lot of different things to different people. So I don't really I don't have a strong definition for crisis because it depends on what you as an individual term as crisis. So the crisis center, usually a short-term stay to get somebody in that little quick fix, to get them to see a prescriber and to see a little bit of counseling, get the ball rolling, and then we get appropriate follow-up for outpatient services.
Yeah. So, and also there's a number that you can, I believe, text or call for if you need like immediate help, right?
Yes. A big state nation initiative is the 988 initiative. And that's probably one of the easiest numbers to remember, 988. And for the longest time, we also used our HOPE line, 1-800-567-HOPE or 4673, that we could, if you don't know, there's something you're in a crisis, but you don't know if you want to go to the crisis center, give us a call. Give the HOPE line a call, the crisis line, so that we can help you guide you what the next best steps are.
Right, and it's always great to reach out. Now, for those that want to stay, connected into community health events, you can text to a number, right? And then
yes, I think the Mental Health and Recovery Board has put for any community health related events and health alerts. I think one of the please text START. START to 888-701-2578. And you're going to get updates throughout that time. It's really cool. I myself am, of course, on it, and you just get the updates. It's not just Coleman products, or it's throughout the whole community that health events and community health events pop up and give you a little heads up. So really great initiative by the Mental Health and Recovery Board that we can start, anybody and everybody can start utilizing this.
So, Micah, thank you for coming on today, explaining all the services and help that's out there, because mental health and addiction is out there, and it really is not uncommon.
we've got to just fix that chemical imbalance, but it takes time, and we're here for you.
All right. Well, thank you once again, Michael. Appreciate it.
Thank you so much. Have a great day.
All right. Well, don't go away because we have more when we return.